This call is now being recorded. What can you see on the screen? Anybody unmute and read if you can see?
Disorders of the excretory system.
Excretory
Yeah.
system.
So it's visible as well as audible. Okay. Now let us begin. What are the disorders of the excretory system one by one? First is, it is very commonly seen, that is uremia. What does it mean? The presence of excess of amount of urea in blood is called as uremia. Uremia is caused due to damage to the kidneys. What are the reasons? It occurs due to glomerulonephritis, hypertension, diabetes mellitus, or some other disorders that impair the functioning of the kidney. So these are the reasons that uremia is observed. Excess of urea comes in the urine, then it is called as uremia. Glomerulonephritis means these nephrons, they cannot function properly. What is the function of nephron? That means filtration, ultrafiltration. So that filtration is not done properly in this case. Instead of only small molecules, large size molecules also, they are filtered. So that means these nephrons are not performing the functions properly. Hypertension, then diabetes, and some other uh, reasons might be there which causes this disorder, uremia. Uremia is usually treated by hemodialysis. Hemodialysis is a procedure used to remove waste from the blood using a dialyzer, a mechanical device to clean the patient's blood, that we will see in the next part. Second, which is related to the excretory system, that disorder or dysfunctioning, is called as renal calculi. Renal means related to kidney. Calculi, that means stones. Calculus, stones. So renal calculi means kidney stones are hard crystalline structures formed in the urinary tract when the concentration of certain constituents such as uric acid, oxalates, etc. in the urine becomes too high. When uric acid oxalates some salts, they are in more concentration observed in the urine, then they form the stones. They form the crystal form. And so these crystals are nothing but the called as kidney stones. Dehydration is the one more major cause for kidney stone formation. Glomerulonephritis means it is a renal disease characterized by inflammation of glomeruli or blood vessels of the kidneys. Inflammation is observed to the blood vessels of the kidney. That means which blood vessels? Glomeruli, which are present in the Bowman's capsule. So it occurs due to bacterial or viral or some other infection, that is parasitic infections, or sometimes because of some drugs, or even because of the diabetes also. Such type of inflammation to the glomeruli is observed, which affects the functioning. That means ultra functioning of it doesn't take place in a proper way. Renal failure. What does it mean? That means kidney failure. That means kidney is not functioning properly, sufficiently. So that is called as renal failure. Now it is of in two categories discussed. It is, this renal failure is a situation in which kidneys fail to function adequately. Number of other diseases or health problems may cause renal failure, and it is typically detected by an elevated serum creatinine level. If the creatinine level increases, that means kidney is not functioning properly. Now, artificial kidney or dialyzer. The next one. What does it mean? Artificial kidney or dialyzer is a machine that is used to filter the blood of a person whose kidneys are damaged. That means the main function of kidney, that is ultrafiltration, removing the waste, is not done properly. Then in that case, artificial kidney, which is called as dialyzer, is used, and this process is called as hemodialysis. Artificial kidney or dialyzer can be used to treat uremic or renal failure patients. So what is that dialysis or hemodialysis? Blood is taken out from the main artery, mixed with an anticoagulant such as heparin, and pumped into the mechanical device called dialyzer. Means blood is taken out from the main artery of that patient and mixed with an anticoagulant such as heparin. You know why? Anti means against. Coagulant, that means against the coagulation. What does mean by coagulation? Coagulation is the clotting of blood. Against the clotting of blood, why? That heparin is added. Heparin is functioning or working as anticoagulant. If it is removed, and if it gets clogged, then the further process will not take place. So that's why anticoagulant is also very important. In this apparatus, blood flows through channels or tubules made of cellophane. Means the blood is passed through these cellophane tubes. Okay, and the membrane is impermeable to the macromolecules such as plasma proteins, but permeable to small solutes such as urea, uric acid, creatinine, mineral ions, etc. Means that membrane, that cellophane membrane, is, or the tubes which are made up of cellophane, the membrane or the wall that is made up of in such a way that it is impermeable to macromolecules, means large size particles or large size molecules like proteins, but it is permeable to small solutes such as urea, uric acid, creatinine, mineral ions, etc. This is the hemodialysis machine where it is shown how it functions. See from the artery how this blood is taken, blood removed for cleansing. This is the dialyzer, and in this dialyzer machine, this cleaning of the blood, that means removing the waste from the blood, is done. The membrane separates the blood flowing inside the tube and the dialyzing fluid, that is called as dialysate. That fluid is called as dialysate. So dialyzing fluid is there where it cleans the blood. Cleaning of the blood means removing the waste from the blood is done. Dialysate has the same composition as that of plasma, except the nitrogenous waste. Okay, so plasma, which contains proteins and all other compounds, but except nitrogenous waste that dialysate contain. So this, the cellophane membrane allows the passage of molecules based on concentration gradient. How they are present, in which concentration they are present, accordingly after that cleaning of the blood, this dialyzer, that clean blood is again taken, returned to the body. So from one artery that is taken out for cleaning, removing the waste with the help of this dialyzer. These are the cellophane tubes which are helpful for permeable for the micromolecules, impermeable for macromolecules, and that cleaned, where the nitrogenous wastes are removed, that cleaned blood is taken back again to the body. So hemodialysis is the method which is considered to be a boon for thousands of uremic or kidney failure patients all over the world. So as nitrogenous wastes are absent in the dialyzing fluid, these substances from the blood freely move into the dialyzing fluid, thereby clearing the blood of its waste. This process is called as dialysis. The next and the last important part, or you can say in case of kidney failure, is kidney transplantation. You can see this transplanted kidney when the normal functioning is not seen in the original kidneys. Then new kidney can be that kidney can be replaced, which is not functioning properly. So kidney transplantation is the ultimate solution for acute renal failure. Functioning kidney is used in transplantation from a donor, preferably a close relative, to minimize its chances of rejection by immune system of the host. This is very important because if it is the relative, then only there are chances of acceptance of the body, because body easily cannot accept the foreign substance, foreign material, any foreign particle. So that immune system of the body should be able to accept that donor's kidney. So that's why it should be very close relative. Modern clinical procedures have increased the success rate, such as complicated technique. So this is what all about the excretory system disorders. Now we will be observing one video which will revise everything.
Consists of a pair of kidneys, a pair of ureters, a urinary bladder, and urethra. The nitrogenous
Can you hear voice? Just tell me.
urea,
It is breaking, ma'am.
Just a minute.
red colored food. Kidneys are attached to the dorsal body wall on either side of the abdominal cavity. Each kidney of an adult human, the nitrogenous and excretion system consists of a pair of kidneys, a pair of ureters, a urinary bladder, and urethra. The nitrogenous end product in man is urea. Kidney is a bean-shaped red
Is the voice audible?
Kidneys are attached to the dorsal body wall on either
No,
side
ma'am.
of the
No.
column in the abdominal cavity.
At least some.
Each kidney of an adult
मैम थोड़ा थोड़ा ब्रेक होते हैं.
measures
Okay.
10 to 12 centimeter in length.
The voice is audible, but we are not able to understand it.
Centimeters
Okay, I will repeat.
with an average weight of
Average weight
120
120 to 170. What the description is given below. Just listen that.
Is convex and inner margin
This is outer margin cortex, which is convex, and inner concave.
is concave. The notch present on
This notch which is present here near the inner margin is called as hilus.
artery, which brings blood to the kidney.
Artery brings blood to the
Enters
kidney
kidney
for purification.
renal vein, which carries blood from the kidney to the heart.
Renal
Ureter come
vein
out of
carries
kidney.
blood from kidney to the heart.
Each ureter is a thin walled tube.
Each ureter
The
is a
anterior end of
small
ureter
tube.
is wide. and
Anterior
called
area is
renal vein.
wide.
The ureter opens into urinary bladder.
Ureter opens into urinary bladder.
Is stored in the bladder.
Stored
Urine is filled
urine is stored in the bladder,
and sent out through a
and
canal.
then through urethra it is passed out of the body.
On top of each kidney, an adrenal gland
Adrenal gland is present on the top of each
endocrine
kidney.
gland and has nothing to do with excretion. Longitudinal section of kidney.
Less of
Outer region
kidney.
is deep red in color and is called as cortex.
Cortex is red in
The
color.
region is light red in color
Middle
and is
region
called as medulla.
light red in color, called as medulla.
Are 9 to 12 inverted pyramid-like structures with a broad base
9 to
towards
10
the cortex and narrow end towards
pyramid-like
the pelvis.
structures,
These extend
and the innermost part renal pelvis.
the broad end of each pyramid
Broad
is broad
end
and gives the appearance of sepals of a flower.
end gives the appearance of sepals of flower, that means calyx, calyces.
Through calyces, Urine reaches funnel like ducts.
So through calyces it reaches in the funnel like ducts.
From pelvis,
From the pelvis it is taken to the
ureters.
ureter.
The cortex extends in between the medullary pyramids as renal columns.
These which are present in between the pyramids, they are called as renal columns or columns of Bertini.
Consists of several thousands of nephrons, which
So
are the basic structural
these
and
are the
functional units.
nephrons, basic
They are
structure.
responsible for urine formation. In human kidney, there are about 2 lakh of nephrons. Each
2 lakh of
nephron has
nephrons.
2 parts. 1. Cup-like structure.
2 parts. 1 cup-like structure, Bowman's capsule. 2 that is tubular portion, renal tubules.
19.3. Bowman's capsule is a 2-layered cup with
Bowman's
space in
capsule,
between
2-layered
the 2
cup.
layers. Inside the cup of Bowman's capsule,
Inside
there
the
is
cup,
a network of large number
large number of
capillaries, which is
blood
called
capillaries are present, called as glomerulus.
glomerulus. Along with Bowman's capsule is called Malpighian body or renal capsule.
Glomerulus in Bowman's capsule together called as Malpighian body.
The renal artery divides into a number of arterioles in the kidney. Each renal arteriole enters a Bowman's capsule as afferent arteriole, forms a capillary network inside the cup-like structure, and leaves
Afferent arteriole enters the Bowman's capsule, forms a network of blood capillaries, and which comes out is called as efferent.
has 3 parts.
This tubular nephron part has 3 parts:
Tubule,
proximal convoluted tubule, distal convoluted tubule, and collecting duct.
distal convoluted tubule of nephrons opens into collecting tubule. A.
Proximal convoluted tubule is highly coiled structure near to the
A highly
nephron,
network called proximal convoluted tubule.
near to the Bowman's
A
capsule.
hairpin-shaped Henle's loop
It
is the next
shows
part of the
U-shaped
tubule,
Henle's loop, which
has
shows
ascending and ascending limb.
descending and ascending limbs.
Distal convoluted tubule.
Distal convoluted
The
tubule.
ascending limb continues as another highly coiled tubular region called distal convoluted tubule. C. Collecting duct. The distal collecting tubule of many nephrons open into straight tube called collecting duct, many of which converge and open into renal pelvis through medullary pyramids in the calyx. The Malpighian corpuscle, proximal collecting tubule, and distal collecting tubule of the nephron are situated in the cortical region of the kidney, whereas the loop of Henle dips into the medulla. In majority of nephrons, the loop of Henle is too short and extends only very little into the medulla. Such nephrons are called cortical nephrons.